One of the most difficult situations to be in a hospital for a healthcare worker is a prolonged cardiac arrest, and not for the reason you're thinking. Imagine this young person, recent surgery, subsequent diagnosis of DVT, and unfortunately one day just really goes blue, clutches at his chest and collapses, cardiac arrest. Obvious pulmonary embolism history, we see it all the time, confirmed it with a quick ultrasound during cardiac arrest compressions, and treatment is started. Strong clot busting medication and CPR for 90 minutes plus. As CPR goes on, you constantly hear the crunching of the bones under your hand with each beat somebody does. Every few cycles, there's a little bit of hope because the heart starts fibrillating a little bit of compression, but there's a clot right there that won't allow it to function properly. And as you cross the 30-minute mark, the medication starts to work horrendously. There's blood everywhere. There's blood coming from the patient's gums, their eyes, their ears, their nails. It's filling up the ventilation tube. And you still need to go on for 90 minutes. You still go on because this person is desperately trying to live. Every few minutes, the heart is trying. But at the 2-hour mark, the heart has almost pretty much stopped fibrillating even. Just weak contractions that mean nothing. And you have to call it. After working on that patient, trying to save their life for 2 hours, you have to call it. You have to call it quits. And that's when the most difficult situation happens. Now you just have to get up and go back to work like nothing happened. If you're lucky, you'll get a few minutes to sit down with your colleagues and have a chat about what just happened. Support the young ones, the ones who've only just seen this once or twice or the first time ever. And of course, have a chat with the students who are now faced with the grim realization that this is the job that they are signing on to. I think that's one of the most difficult things that we do as healthcare professionals. What do you think?